Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, chiropractic, and medical related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan. Welcome to the show. We're here with our co-host, Dr. Ruben Rubenstein.
How you doing?
Out of Troy, Michigan, chiropractor as well. And we have two special guests today. We have Dr. Lyn Peyton, neuropsychologist.
Glad to be here.
And Dr. Al Bayer, who's a case manager and psychiatrist.
It's a pleasure to be here. Thank you for having me.
Welcome to the show. So let's start off, Dr. Peyton, talk about what a neuropsychologist is, what type of work you do, the background you have to get into the profession, and what type of patients you see as a neuropsychologist.
I have a PhD in clinical psychology with a specialization in neuropsychology that you learn under the leadership of another neuropsychologist. And what I do is I look at how is the brain functioning, where are strengths, weaknesses. I do diagnosis and treatment of people who may think that they're having difficulty with some part of their brain. Could be from a brain injury, could be individuals with ADHD. I've been doing psychology for 20 years. I've specialized in neuropsychology for the last 6 years.
And so what is the difference between a neuropsychologist and a neurologist?
A neuropsychologist is interested in the functioning of the brain, not the structure. A neurologist is a medical doctor who's looking at the structure of the brain. It's possible for individuals to have difficulty with their brain functioning, but it never shows up in structural problems.
Interesting. The brain is certainly a very complex structure, isn't it?
Yes, the brain's very complex. Between the neurology of it and the biochemistry of it, there's a lot of intricacies that are, very complicated and interesting to sort through.
Absolutely. And so, Dr. Bayer, if we could talk a little bit about the difference between a psychiatrist and a psychologist, and what a case manager is, and how you got into the work that you do today, and exactly what that is.
Certainly. Psychiatrists in general are medical doctors. Every psychiatrist has gone to medical school, trained in all fields of medicine, but then they're trained specifically in the diagnosis and treatment of psychiatric and behavioral disorders or emotional disorders. Specifically, and they can treat these disorders both with medication and with other forms of therapy. Often they work in conjunction with other professionals like psychologists and social workers and with neuropsychologists and work in a team role to coordinate treatment. Specifically with regards to brain injuries, psychiatrists work in conjunction with neuropsychologists, with other physicians, with chiropractors, with all the professionals to try to work as a team because these injuries are so complex. Case managers work in conjunction with coordinating the team. And they will form a team, a treatment team, coordinate, serve as an advocate for the patient or the client, and coordinate all their medical, financial, and legal needs, and try to make sure that all those needs are being addressed and met appropriately.
And a lot of people haven't really heard of a case manager, don't really understand the role of a case manager. And what we find with our patients, especially when we have significant traumatic brain injury and whiplash type patients, that case managers fill a role very well and really can be the quarterback of the case. And where a lot of these patients don't know what to do, don't know who to see, don't know what doctors to go to, they may not understand some of the things the doctor is telling them or that the attorneys are telling them. And so case managers fill an amazing role of really just keeping it all together for the patients, correct?
Exactly. I find that serving as an advocate for the patient, and communicating things that may be complicated, dealing with the insurance company, which certainly can be complex. Oftentimes they try to set up barriers for clients or patients getting the appropriate treatment, so we try to break down those barriers, working as a liaison between the patient and their attorney, and communicating between doctors as well, because a lot of times people within the treatment team don't always communicate well, so we'll make sure we'll facilitate all those things.
And tell me if I'm wrong, but I would assume one thing that may set you apart from other different case managers is your training as a physician and as a psychiatrist, where not everybody has that training, do they?
My training certainly gives me some more insight into what's going on in the case and allows me to communicate it, I think, at a different level on particular cases and with particularly complex issues.
And I believe that case managers are critical to care because many people that have had a lot of injuries also have, traumatic brain injury or other types of emotional difficulties going on, even maybe just as a result of a reaction to the change in their life, even if they don't have a brain injury. And case managers help them keep it together and get to the right places so that they can get better, because sometimes they're so overwhelmed with what's going on, it's very difficult and almost impossible to manage on their own.
And would you say with some of these patients, it's just so strenuous or overwhelming for them to even make appointments, go to appointments, deal with people, talk to people, that this role is so necessary?
And they have a lot of one-on-one time with the patient as well. I mean, after a traumatic brain injury or some sort of accident, that these people need someone there for them. And that's what your role is as a case manager, correct? To be there for the patient.
Exactly. A lot of times we'll go to an appointment and they'll present what's going on, but they'll forget about certain symptoms, they'll forget about certain reactions or problems they're having with medications, and those are things I can facilitate. I'll give them a schedule of their appointments and coordinate transportation and things like that. So I try to be basically their best friend, make their life easier, and make sure that they get the appropriate treatment and all the things that they need.
And it helps probably with the healing process of everything.
Exactly.
Just having someone there to help them through the process, because I know even for someone without a brain injury, that's a stressful thing to deal with. So I mean, you add that on top of it, then having someone like you is definitely beneficial.
It's nice to feel that they have someone on their side at a time when they think that everything's against them.
Right.
Well, and as a neuropsychologist, it also helps me, because if I see things going on that need to be addressed by their rehab doctors, I can talk to the case manager and say, we need to make sure this is getting addressed, or I've noticed this, because I spend a lot of time with people, and being able to identify, situations like one patient was having trouble, and they were having trouble getting her to move. She'd been like 5 years after an accident, and they were describing her as a bump on a log. And when she came in, different set of eyes looked at it, and I suggested to their doctors that they look at whether she might have sleep apnea, because she's got such sleep disturbance. And they found that. And, so all of us working together is really beneficial to the person.
And have you noticed that patients with a case manager and then patient without a case manager actually get better results?
I think they get better results because they aren't overwhelmed with it. They get to the right doctors. I think they don't get as overwhelmed, so they can concentrate on healing versus concentrating on managing their way through the medical system.
Dealing with insurance companies and things like
Absolutely.
that, absolutely, with the claim adjusters and everything. And one thing we see as chiropractors a lot is that a public perception of chiropractors is that we don't like to work with medical doctors. We don't like to work with other people in healthcare, and that's not the case at all. Maybe a generation or two ago, that perception came about, but as a chiropractor, we are always happy to co-manage with other types of physicians, to work with people and refer out anytime necessary.
And that's what's great about working with a case manager, because at the end of the day, we're looking to get the patient better. So if you're managing a patient, you understand that our best interest is on the patient.
Right.
So if we're co-managing a patient, going to a neuropsychologist, going to a chiropractor, the goal is to get the patient better.
Exactly, and I think my goal in putting together a team is working with professionals who all have that same goal, have that same mindset, and are willing to work together as a team, as professionals, collaboratively, and understand what input they can provide to have a positive outcome.
Absolutely.
Right. And working as part of a team, if I do a neuropsychological evaluation, I can let the case manager know this person needs some occupational therapy or speech and language therapy, or they need some psychiatry. And then they can go make that happen. And I can work with them on the aspects of emotional and behavioral, but the case manager is helping them get better in those other ways.
And it's nice to be able to, especially with the modern technology, to be able to share records very easily. Like, it's nice that we'll get from a case manager as soon as, let's say, they're a primary care, before the patient had seen us, had ordered an MRI, and the patient doesn't have it, and the case manager gets it to us right away. We want to know everything that's going on with the patient so that we can make the best diagnosis and do the best available care for the patient based on everything else that's already happened.
Right. Yeah, that's another part of facilitating the communication process. And instead of you getting a volume of records, I might summarize it in 3 or 4 pages,
Correct.
which would make life easier
Save
for
us a
everyone.
lot of time. And make it, exactly, absolutely. Let's talk for a minute about specifically what traumatic brain injury is, TBI, and it's a word that some people have now heard, especially with a lot of the things that people are hearing now with concussion. That's becoming a popular thing, seeing everything that's happening with the NFL, pro football, what recently happened at U of M, at hockey as well. And so people are starting to really open their eyes to what a brain injury may be. So let's talk a little bit about specifically what traumatic brain injury is, maybe some of the structures of the brain itself.
Okay. Well, a traumatic brain injury is damage to the neurological and nervous system functioning in the brain. Also could be a biochemical change in the brain, usually after a concussion. Not everybody that gets a concussion will get a brain injury, but people that have a brain injury somewhere along the line experience one or multiple concussions. And many times people walk around not knowing they have a brain injury, but most common they'll say, I don't feel like I'm the same person, or their family will say they're not the same person as they were before whatever happened that created the concussion. Or they're more emotional, or they engage in behaviors they never engaged in before. One time I had a client who had never gambled in his life, and went out and ran up $50,000 in debt, in gambling debts. It'd been something he'd never done before. But nobody recognized he had a brain injury. It's looking for how are they different? Are they dramatically different from it in different ways from what they were prior to the auto accident or the multiple concussions, which some of our football players or other people are experiencing.
Yeah.
And let's explain to our studio audience what exactly is a concussion. When someone hears that word, what does it do? What does it do to the brain or the head?
It's a concussion. Basically, if you think about it, if you think about it's trauma to the brain, or it's like a bruise to the brain. Basically, if you bruise your knee or your elbow and you stay off of it for a week or two, it gets better. You're never off your brain though. Even when you're sleeping, your brain's still working. You're dreaming. It's still taking care of your body, so it never really rests. So. In terms of when a person has a concussion, it's when if someone has a head injury and they've been in a coma for 3 weeks and they have tremendous changes when they come out of it, that's easy to detect. But we're looking at people with more subtle changes, that maybe they've been in an accident or they've been tackled in a football game. They passed out for a few seconds to minutes. They're kind of dazed for a few days, and then after that, they just don't appear themselves. They may be, as Dr. Peyton said, they may be more impulsive. They may engage in behaviors that they didn't before. They may be more irritable. So you see behavioral manifestations. You also see cognitive manifestations where they're more forgetful. They have trouble processing things. They'll read a page in a magazine and not remember what it was. They'll forget appointments that they never used to do. They'll be speaking in conversation and not remember what they were saying, or have trouble keeping up. All these things are very common manifestations, and oftentimes they aren't detected, especially if there are other injuries. And it's really important that we detect these things and treat them, because the earlier we can bring in interventions, the better the outcome.
What would you say is a suggestion of how long after a concussion you should either stay out of work or stop playing sports? I know in sports they say, oh, you have to wait at least 24 hours to get back in the game. Would you suggest getting back in a football game after 24 hours of a concussion?
I would wait at least a couple weeks.
Okay.
If there's a concussion, if there's been any loss of consciousness, if there's any change in cognitive functioning, which is basically intellectual functioning, I would wait at least a couple weeks and maybe get a battery of testing done and make sure that there's been a return to baseline.
And
what's
I'm sorry.
Go ahead.
There are people that can have brain injuries that never lost consciousness either.
That's correct.
And, if you have one concussion, it's very important not to get back into doing anything where you could hit your head again, because a mild brain injury you might spontaneously recover from.
Yeah.
Some people do, some people don't. But if you have that mild brain injury with a concussion, and then you get hit again.
A bunch of milds equal a severe.
Only 2 milds can equal a severe.
Can even cause death even.
Yes,
Yeah.
it can be very dangerous and very debilitating for the future of that person.
Yeah.
Right. I think we're seeing that in football where they have the chronic traumatic encephalopathy with some of these football players that have died or committed suicide. And they're seeing these changes in the brain where there weren't any episodes where they're unconscious for long periods of time, but it's the repeated brain trauma from the tackling, from the hits to the head, that cause these brain changes and cause change in their behavior and they're probably their underlying biochemistry.
And these days, we're much better at finding out when they have a concussion, diagnosing it, keep them off the field, where 20 years ago, what was it?
Get back in the game.
How many fingers?
Yeah.
Just get back in the game, right? And so we're doing a much better job of it these days, but we're starting to see the long-lasting effects from what happened years ago with some of these football players, hockey players.
That last generation of injuries is now playing a huge effect on the people who are now retired. You're saying, okay, look at them now. They're 50, 60 years old, and they look and act like they're 80, 90. They have the mental capacity of someone who they can't remember anything. So it's pretty awful.
It's important to make sure that you don't get back into anything until you've recovered. And recovering isn't like 2 weeks, you'll be fine.
Yeah.
It's seeking
Reevaluated.
professional help, being evaluated. People who are playing sports or engaging in activities where there's a potential of a brain injury should really have some pre-testing done so you have a basis of comparison.
Exactly.
If they get a concussion, to know, have they gotten back to pre-injury level of function?
You have a baseline measure that you could compare to if there is a concern about a concussion or a traumatic brain injury.
That's what's hard with all injuries. Even you get into a car accident, like, oh, are you as what you were before? We have no idea because you weren't being treated. That's why everyone should be under care of some sort just to get a baseline. That's very important.
We see that even with musculoskeletal injuries, not
Yeah.
even just brain injuries with someone, let's say, in an auto accident, to see if they're a pre-existing condition. If we've never seen
Yeah.
the patient before,
How do we know what
we
the
have no
pre-existing
proof to
condition
show
is?
one way or the other.
Exactly.
Right. We have a great video clip we'd like to show. It's a little physiology of the brain and how some of this stuff works. So if we could roll that video clip, we'll come back and talk about it.
The brain is the most complex part of the human body. This 3-pound organ is the seat of intelligence, database of memories, interpreter of the senses, and the director of all movement. Lying in its bony shell and washed by protective fluid, the brain is also the most fragile organ in the body, with the same texture and consistency as gelatin. Within the brain are over 100 billion nerve cells, called neurons, sending electrical and chemical signals to and from the body. Each neuron has a cell body, a long nerve fiber called an axon, and projections of the cell body called dendrites. Dendrites extend out from the cell body to receive messages from other nerve cells. Axons in the brain connect neurons with each other, which in turn provide extensive interconnections with other brain areas. Because the brain and its nerve cells are so fragile, sudden, rapid movements of the head can cause injuries. During one such injury, called coup contre coup or acceleration-deceleration injury, the brain bounces back and forth against the bony interior wall of the skull. In high-speed coup contre coup injuries, the impact may be violent enough to cause swelling and bruising of the brain tissue, called a contusion. However, in cases involving low-speed coup contre coup injuries, the resulting damage may not be visible to the naked eye. As the brain moves back and forth within the skull, areas of varying density in the brain slide over each other at different speeds. Axons crossing these junctions experience tremendous shearing forces, causing them to stretch and tear from the cell body. This event is called axonal shearing, or diffuse axonal injury. Brain damage can continue to occur for hours or days after the initial injury. Damage to the axons can lead to a breakdown of communication among neurons in the brain. The torn axons quickly degenerate, releasing toxic levels of chemicals called neurotransmitters into the extracellular space. In turn, many of the surrounding neurons begin to die over the next 24 to 48 hours, worsening the initial effects of the injury. Mild to moderate cases of diffuse axonal injury, or DAI, may result in symptoms such as brief loss of consciousness, impaired long-term memory, reduced problem-solving ability, lower social inhibition, and problems with attention and perception. Severe cases of diffuse axonal injury may result in coma or a persistent vegetative state. In the United States, over 1 million cases of mild traumatic brain injuries, including diffuse axonal injury, are reported each year. Of this number, over 300,000 patients suffer long-term effects from the damage. Computed tomography, or CT, and magnetic resonance imaging, or MRI, are tests that can be performed to check for mild traumatic brain injury. The results of these tests usually show a normal reading. Therefore, doctors must rely on patient history and a clinical exam to diagnose mild traumatic brain injury.
So I always find it interesting to see sometimes even how little trauma or actual blunt force can cause concussion or brain injury. And a lot of times people don't really realize that, and they just think they hit their head pretty hard. Even if they dazed out for a second, they think, I feel good, I am good. And that's not necessarily the case, right?
No, sometimes the injuries or the damage to the brain can be weeks or months after that type of injury because of the way the brain works. And you don't even have to hit your head to be injured. Just a strong motion forward back like someone would have in a whiplash situation can cause a brain injury, and many times it's into the frontal part of the brain.
And you can see here, if we have our brain model, the skull is around it, and as the head comes forward, the brain actually can move around in here and actually cause this trauma. So the coup, counter coup, is even without physically getting hit in the head, we can cause brain damage or brain injury from this type of a whiplash motion, from severely bringing the head back or forward, and it wiggles around inside the skull.
And we have to consider that the brain is like the consistency of Jell-O.
Yeah.
It's Jell-O banging against a hard surface,
which is your skull.
which is your skull that's there to protect it.
If you think of your brain as like the yolk of an egg and your skull as the shell, when you have, if you're traveling at like 40 miles an hour and you hit a wall or hit a tree or hit another vehicle, you suddenly come to a stop. So your skull is stopped, but your brain's still moving inside of it. It hits the skull. So even if your seatbelt stops you or the airbag goes off, your brain can still hit your skull in the back, in the front, and then go back and hit it in the back as well. And it can add almost like a pinball, like an egg yolk within the shell of an egg. And it can do a lot of trauma, even if there isn't any direct trauma to the head.
Yeah, like we were saying, I mean, you might not even black out or anything. You can have, if you've seen on TV, people with minor brain bleeds. They don't even know they're there. And all of a sudden, years later, they go and check, and then it's the minor ones turned into a big brain bleed. And then now they're starting to have symptoms. And, oh, what had happened? Oh, a few years ago, I was in an accident.
Well, in some people, you can't, on an MRI, even see a brain bleed, and they've still got a brain injury.
Yeah.
Many times people will come in and their MRIs will show no damage because structurally it's not there.
Mm-hmm.
But there is damage because you can see it in how their brain is functioning.
Yeah.
They're having trouble with memory, emotional control, and it depends on where the brain was injured.
Right.
And where that damage is done. They might have weakness on the left side.
Yeah.
Because they had a right side brain injury.
Oh, yeah.
And that's where neuropsychological testing is critical, where they they look at functioning, not at structural damage, but they look at functional damage and how it's affected things like memory, attention, executive functioning, their ability to process things, take things from short-term memory into long-term memory. All those things can be impacted by brain injury that you may not see on an MRI, which just shows if there's a bleed or structural damage, which isn't always the case.
And what we see is some of these cognitive changes, depending on where they had damage in the brain, can express as different cognitive symptoms, right? So there's parts of the brain that control more of the emotional side, like the limbic system, or more of personality, like the frontal lobe. If someone gets hit, let's say, you hear of cases all the time, someone got hit really hard in the back of the head, they went blind because they hit the occipital lobe, what controls sight. So depending on where they have injury in the brain dictates symptoms they may feel or express cognitively. And a lot of times, again, people think if they feel good, they are good. Meanwhile, they could have a significant brain injury, and just because they don't have a headache or a constant migraine, they think they're good, and it's not the case at all.
Well, and sometimes they don't even know that they're not functioning like they were prior to the accident.
Because it feels normal to them.
Well, it feels normal to them, and I had a client one time who, you know, about 12 months after the accident, realized that they missed something and said something to his daughter, and she says, "You've been forgetting all the time since the accident." "Well, why didn't you say something to me?" "I thought you knew."
Yeah.
How would he know that he was forgetting? He wouldn't. So he didn't know he was forgetting all kinds of things and missing things and doing things. So it's important for the family to help look at how is the person different.
Or that's a great example of the need for a case manager.
Right.
Just right there,
Right,
you know.
things slip through the cracks. I had a client too who after an accident, he hit the back of his head on the headrest, went back to work, actually went to a meeting after the accident, and then went to meet with his accountant 3 months later and realized he hadn't reconciled his books for his company for 3 straight months, which he'd never done before. Just totally forgot about it. And that's when he called me and said, "Something's wrong. There's something wrong with me." And he got neuropsychological testing, saw a neurologist, and started the whole workup, and he's now in a cognitive rehabilitation program.
Yeah, so I'm going to talk about this case study we have here of the role of actual chiropractic in traumatic brain injuries. And this was just a 55-year-old woman who had 2 minor accidents, and then she started having numbness and tingling in her legs, dizziness, insomnia, and all these things. And under a few months of chiropractic care, she noticed it was all disappearing. So chiropractic care, case management, neuropsychology, all these things together can actually really help the patient. So
In
that's the
some way
message we want to make sure everyone knows today.
Absolutely. In some way, we can absolutely all work together. And here you see a few pieces of the puzzle. At this table, we don't have many of the other pieces of the puzzle during this episode, but you know, everyone from physical therapy to neurology to orthopedic to chiropractors to neuropsych, all of us can work together and really work as a team to help some of these patients the best that we can.
Right.
So I want to thank everybody for joining us today. I thank our special guests here, and thank you all for joining us on Ask the Chiropractor. I'm Dr. Adam Rodnick out of Commerce Township.
And I'm Dr. Reuven Rubenstein out of Troy, Michigan.
And thank you for joining us. Remember that God gave you the gift of life. What we do with that life is our gift back to God. We'll see you next time on Ask the Chiropractor.